InFocus. I'm Lujia Lin. Our guest this week is Dave Graham-Squire, a research associate at the Center for Labor Research and Education here at Berkeley, and the co-author of a recent report on health reform entitled No Recovery in Sight. Welcome, Mr. Graham-Squire.
It's good to be here, Lujia. Thank you.
All right, I'd like to start off by talking about your report, which concludes that health coverage in America, in the absence of reform, would get significantly worse by the end of President Obama's first term. So how did you arrive at this conclusion?
So what we did was, using government survey information, we sort of looked at trends in healthcare coverage, particularly focusing on different segments of the population. And based on this information, we then we built a model and predicted what the healthcare landscape in the United States and in California would look like in 2012.
Okay, so you mentioned the period from 2000 to 2007, which was a period with only one recession year, 2001. So in all these good years, why did this problem still occur?
People are losing their jobs, and because they have healthcare coverage through their jobs, they're losing their healthcare too, and we have more uninsured people. There's been another, besides the economic crisis, there's been a healthcare crisis that's been happening in this country. And particularly in the last 8 or 9 years, we've seen a very consistent trend that as healthcare premiums are increasing and are increasing well above inflation, it's becoming more and more expensive for employers to cover individuals. And so what we show is that this current healthcare crisis, even if there's going to be a full recovery, we expect that even more, by the end of Obama's administration, there's going to be even more people uninsured.
What demographics would be hit particularly hard by this situation?
Well, what we found is that it's primarily, especially this loss in job-based coverage, is happening not so much among the lowest income individuals, because often there are public programs, but particularly individuals who are sort of between 2 and 3 times the poverty level, they're going to be hit particularly hard.
Given this situation, if a change were to be, or any type of reform were to be implemented, what form should it take?
The types of policies that are being talked about lead to, ultimately, a little bit more regulation of healthcare, the healthcare industry and the pricing of it, and often expanded public coverage. So essentially businesses are paying into a program that then, a government-run program, that then funds healthcare coverage for individuals and for families.
Okay, now certainly you believe this is a very severe situation that needs to be solved immediately, but there are certain commentators who have been criticizing the administration, saying that it should focus singularly on the financial crisis before moving on health reform or any other major issue. So what time frame do you see as appropriate for this issue?
It's clear that if we don't act soon, there's currently it's true that there's a cost to this, to providing healthcare coverage. But I think what's even more significant is that there's even a bigger cost if nothing is done. It's too costly to not act at this point.
Okay, Dave Graham-Squire, thank you so much for this interview.
Thank you.